COVID-19 was declared a global pandemic on March 11, 2020 by the World Health Organization.
Who could have imagined that 1 year later, we would still be in this public health crisis?
COVID-19 has impacted everyone in the world, and everyone has experienced COVID-19 in a different way. Let's look back at some of the words that have become part of our new normal over this past year.
Hand washing,
Zoom,
virtual celebrations,
flattening the curve,
uncertainty,
toilet paper,
social injustice protests,
quarantine,
virtual learning,
PPE,
pivot,
masks,
lockdown,
grief and loss,
social distancing,
bubble,
frontline workers,
coping,
community.
hope.
As we think about this past year, we should consider the impact of COVID-19 and how it has been different for everyone.
Being kind, caring, understanding, and thankful makes a big difference for each of us and helps us get through this together.
Mental health and well-being may be words we hear, but don't stop to think about. What do these words mean to me? What did I do this past year to look after my mental health and well-being? Let's stop and take a moment to think about what mental health and well-being mean for each of us. What can we continue to do or start to do to take care of ourselves?
It could be something small, like going for a walk, reaching out to others, taking a moment to stretch and breathe, or whatever may work for you.
It may also be helpful to reach out for support. There is no problem too big or too small to ask for help. Be kind to yourself. Recognize that in this moment, you are doing the best that you can.
Please check out the links below for additional resources and supports.
Not everything that weighs you down is yours to carry alone.